number 5, doctor experience level.
How does that feel?
Weird.
Perfect.
An experienced surgeon can be the difference between implants that can last a lifetime and implants that end up failing. If the procedure must be redone, this will drive up your overall dental implant cost.
How many implants has the surgeon placed? Do they place them on a regular basis? How many full mouth restorations do they do in a year? How many have they done over the last 5 years? You could find yourself in a situation where you'll have to have the procedure repeated later on.
Not all oral surgeons have equal levels of certification and experience, and some less qualified doctors may resort to lowering their prices in order to attract new patients.
At Nuvia, our surgeons and restorative doctors perform these procedures day in and day out. From measuring, fitting, mapping, and ultimately planning out the procedure collaboratively between the surgeon and the restorative doctor allows us to precisely execute the implant placement.
Number 4, quality of the material used.
What do you think?
Well, I think I shouldn't look directly at them.
Patients need to ask, what are the quality of materials used? That is going to determine a large portion of the cost.
Now this is a denture. It's a regular denture. It's made out of all acrylic. The pink part and the teeth are all the same materials. Then we move on to the implants. Most implant fixtures are made out of titanium. Now this is an acrylic prosthetic. This material is the same material as the denture, just in a different application. It's typically a temporary set of teeth that would go on implants after surgery, otherwise known as teeth in a day. This acrylic is not going to stand to the test of time, which moves us over into the world of zirconia prosthetics. Zirconia is a harder material and stronger material than the acrylic, and because of this, zirconia teeth may have a higher initial cost, but it may actually be more cost efficient in the long term because they are less likely to break or wear out. Choosing a cheaper quality material to be used as permanent teeth may require you to have them repaired or replaced later on as they wear down. Here at Nuvia, it is our plan and goal to give every patient permanent zirconia teeth in 24 hours after surgery. However, patient's anatomy will dictate the type of prosthetic they get.
Number 3, out-of-country dental procedures, otherwise known as dental tourism.
Those considering traveling out of the country to have an implant procedure done should be cautioned. The procedure and materials used in other countries may not be of the same quality as those in the US. And it's not uncommon for patients who have had procedures done abroad to experience implant failure or need work to be fixed or redone. In these cases, an initially cheaper procedure may end up costing the patient much more than just having it done in the US in the first place.
The challenging thing is that when we see these patients that have already had the treatment, and most of the times they're having some sort of problem, it's very difficult to travel back and forth to where they got the treatment done.
You need to have a plan in place that if something does go wrong, you'll be taken care of.
On to number 2, general anesthesia.
Now you will go to sleep, or I will put you to sleep.
There's generally 3 anesthesia options that are used for dental implant procedures. First is local anesthesia. This option is generally reserved for single implant procedures. Second is IV sedation. This option may be offered for single implant or full arch procedures. It's important to point out that there is a chance that the patient will be somewhat conscious and aware during surgery under IV sedation. Third is general anesthesia. When a patient is under general anesthesia, the surgical team can better protect the airway, preventing any unwanted objects from entering the lungs. General anesthesia is generally the more effective option when it comes to anesthesia for dental implant full arch procedures. However, it can be more costly. At Nuvia, we have a dedicated anesthesiologist performing the general anesthesia at no extra cost to you. This way, the implant surgeon can focus on the procedure itself.
And finally, number 1, the biggest influence on the cost of dental implants is permanent teeth in 24 hours.
24 hours later.
At Nuvia, we use highly accurate digital mapping technology to scan your mouth after the implants are placed. Therefore, your permanent set of prosthetic teeth are created overnight by our team.
So instead of waiting sometimes up to 10 months for a permanent set of teeth with the traditional teeth in a day method, you can get a permanent set of teeth within 24 hours at Nuvia. After your permanent teeth are placed in 24 hours, you can start eating soft foods and smiling like you just don't care.
If you have other questions about dental implants, please leave a comment below and we'll be sure to answer your questions in a new video every week. Find out if you're eligible for permanent zirconia teeth in 24 hours by taking our 60-second quiz up here. To find out the true cost of dental implants, click on the link below and keep on watching.